What's up guys, it's Stephanie again. I'm back again with another video. So today I'm going to be talking about my experiences before applying PA school. So basically what healthcare experience I had, what research experience I had, the type of volunteer hours I did, the PAs I shadowed, etc. So I'll be providing this information so I can help you out if you are wanting to apply to PA school. Basically what type of volunteer service you should look for, or research, healthcare experience, or patient experience you should have. Once again, this is just my experience. Of course, there's a lot more experience you can have, but this is just what I did for PA school. I was actually just accepted into PA school last year in December, so 2017. So I'm really excited to start this year. Finally, after the second attempt of applying, I was finally accepted. So if you can just keep watching this video, I'll talk a little bit more about my experience, and thanks for watching. Bye guys. What's up guys? So as you can tell by my t-shirt, I love DC comics. I just love superheroes in general. I tend to go a lot to the Comic Cons, whether it's in San Antonio where I'm from or Paso where I'm currently living. I love going to the Comic Cons and dressing up as Spider-Man, Deadpool, Lady, etc. So I really love all that. I love DC, Batman, and Superman, and Wonder Woman. Of course, Batman is my favorite, so hence why I'm wearing the t-shirt today. So today I'm going to be talking about my experiences for PA school, basically what I did to get into PA school, what type of healthcare experience I had, what type of research I had, also the volunteer type that I did, the PAs I shadowed, etc. So I'm just going to be talking a little bit more about that. In regards to my healthcare experience, what I had is I worked for hospitals, or several hospitals throughout the city in San Antonio for 5 years. Yes, 5 years. And for those 5 years, I worked in a variety of healthcare fields. It was the emergency room department, labor and delivery, surgery department, emergency psychiatry, so psychiatric departments, and also my most recent job, which was working in an urgent care. So I was able to work in a variety of healthcare settings. So I worked really close to doctors, nurses, other medical staff, emergency room staff, x-ray technicians, other technicians, etc. And PAs, of course, and nurse practitioners. So I worked really close with them. This is how I found out about becoming a PA, or why I wanted to become a PA, or what a PA was, is that I worked really closely with them, and I really liked the job. I really liked the profession, and I said, hey, I really want to do this profession. So one of the reasons why I decided to become a PA. And throughout the 5 years, I worked as a registrar. So basically, the individuals that go up to you and they obtain your patient information, update your charts, verify insurance, etc. So that was what I did in the hospital setting. In the urgent care, I started as a front desk, and the majority of the year that I was, 2 years that I was there, I did do front desk. So same thing, I checked in patients, checked out patients. But my manager was very flexible with me, and she knew that I wanted to become a PA, so she allowed me to be cross-trained to back office to become a medical assistant. So this is how I gained actually my hands-on experience, because I had about probably more than 10,000 hours of healthcare experience, but I had no patient care or hands-on experience whatsoever. So becoming a medical assistant and being able to help the staff that I worked with in the back, who were really helpful in helping me and cross-training me, I was able to learn how to do EKGs, how to triage patients, obtain vital signs, perform injections, etc. So it was a great job working in the urgent care. I was able to be cross-trained, and that's how I gained my patient care experience hours, so hands-on experience. So I had about more than 1,500, I think it was 1,600 hours. So for some schools, I actually barely made the deadline, or I would say, the requirement, the minimum requirement per patient care experience hours, so I barely made it for some schools. Some schools did require a lot more, so of course I didn't apply to those schools that did require a lot more patient care experience hours. Now, in regards to my research, I did research for 2 years. I graduated from the University of Texas A&M. They have a Texas A&M branch school in the city of San Antonio, so I attended Texas A&M University in San Antonio, And I worked alongside one of my professors who I got really close to, and she's a really good friend. I consider her a really good friend. And she was just great. I worked with her with mosquitoes, so I did mosquito research. Basically, I started in the year in 2016 when the Zika outbreak broke. So everybody was really concerned about the Zika outbreak, and nobody knew that much about the virus, what type of mosquitoes transmitted him. And so I thought this was a great opportunity. So I approached my professor at the time. She was teaching parasitology. She was my parasitology professor, and I approached her and I told her, hey, I want to do research. I'm interested in doing research, and she allowed me to do research with her. So actually, myself and my sister did research with her, and it was a great experience. And I really recommend research, any type of research, for any individual who is wanting to become a physician assistant, because you gain so many skills. I gained critical thinking skills. My communication skills were even better. I was able to obtain data and be able to interpret that data, which was fantastic. So I really liked that experience. Basically, what we did for the research is that the city of San Antonio has a lot of mosquitoes. Since we are in an area that's very humid, it's a great environment for mosquitoes. So what we did is that in the city of San Antonio, we found out what mosquitoes are more predominant or more abundant. And we looked for areas of San Antonio that had the highest amount of mosquitoes that would, if there was a Zika outbreak, that would be vulnerable to the Zika virus. So
Zika-carrying mosquitoes here in San Antonio. News 4 San Antonio's Andrew Lawfom is live in the King William neighborhood. One of the places they are trying to see just how densely populated the Zika mosquito is there. Andrew?
This was a story we first told you about back in April. These researchers were looking for volunteers to allow them to put this trap in their backyard. Now, since that story aired, over 400 people volunteered. Now, here's what they're looking for. It's the Aedes aegypti mosquito. That's the one that carries Zika virus. Texas A&M San Antonio might not have any sports teams quite yet. Athletics, when you guys?
For the mosquito patrol.
This is the 10-member patrol's office. 120 yards just like this one, spread all over town.
Color-coded based on my students. So if you were to call them out and I can count them.
Once a week, they'll check all.
as some of you may know, the mosquito that transmits the Zika virus is Aedes. Any Aedes species mosquitoes, so Aedes aegypti, Aedes albopictus. So those were the type of mosquitoes that we were looking for. So I did 2 years of research with my professor and other students, and it was a great experience. I really enjoyed it, and I was able to add it to my PA school application. So I remember when I applied to PA school, one of the interviews, or some of the interviews that I had, some of the students were actually some of the staff that interviewed me, they were very, very interested in my research. And so I was able to talk a little bit more about my research with them. So it was a plus, I think, for my application. And of course, I got really close to my professor. Also, she wrote me a wonderful recommendation letter. It was about 2 pages when she showed it to me. So I think that was another thing that got me into PA school, was a great recommendation letter that she wrote me. And I would also say, in regards to the PAs that I shadowed one of the PAs I worked for in the urgent care. He's a great PA, and whenever there was patients that came in that needed to be sutured, or just a difficult case of why we weren't able to take care of the patient in the urgent care and we had to send him out to the ER, he always was very approachable. He always allowed me to shadow him. He would show me, etc. So he was just a great PA to shadow, and he wrote me a good recommendation letter also. So I'm very thankful to him. Of course, all the other PAs that I worked with were also fantastic. They also allowed me to shadow them, ask them questions about PA school, what they did, etc., to get accepted into PA school. So I really liked my urgent care job. And then I would say for my volunteer hours, I volunteered for the Habitat for Humanity. So in San Antonio, so for there we would go and build homes for the underserved communities of San Antonio. So I really liked doing this also because it was interesting to see that when I was doing the research for the mosquitoes, we would go out into the community and ask individuals if they would volunteer their homes to set traps to obtain mosquitoes. And some of the homes where we set the traps were individuals who had their homes built from Habitat for Humanity. So it was great to see the fact that it able to build homes for these individuals to live in. And these individuals are so grateful. They're so thankful. They're great. So it was a great experience also. I think I had about 500 hours of volunteer. So it wasn't that much, but I had some hours. I wish I would have been able to do more, but unfortunately the majority of my undergraduate years I was working 2 jobs or 1 job full-time and attending school full-time. So it didn't allow me to have that much time to be able to do a lot of volunteer hours. And yeah, I would say that is my experience. Basically, the PAs I shadowed, my healthcare experience, my patient care experience, the fact that I was able to be cross-trained, and also the fact that I was able to attend school full-time at the same time as attending or being able to work full-time in order to pay for my tuition. So I'm very grateful for that and the fact that I am accepted into PA school. So yeah. This is just my experience. Like I said, if you have any questions or concerns, just feel free to contact me. Leave a message below or a comment, and please like this video if you like it. And thanks. I'll talk to you guys later. Bye.